important thing is what is a causes of pneumonia? Does anybody had heard of different type of pneumonias? Just tell me pneumonia.
Aspiration pneumonia.
Very good. Aspirational pneumonia. Yes. Anyone else?
Ventilator associated pneumonia.
Very good.
Yes.
Ventilated associated pneumonia. Bilal Khan,
Yes, ma'am.
any example of pneumonia if you remember?
Bacterial pneumonia.
Bacterial pneumonia? Yes.
नहीं,
Pneumonia
वो
due to
तो
infection.
काजीज में आता है ना, बैक्टीरियल तो.
Anyone have heard of inhalation pneumonia? Inhalation pneumonia is there. There's another pneumonia which is called as microciliary clearance disturbance pneumonia.
एलर्जिक है ना वो,
Sorry?
एलर्जिक नमोनिया से.
No. Allergic is asthma.
तो
No, it's not okay, this thing. Okay, so first of all, let's talk about your aspirational pneumonia. So, what do you mean by aspiration?
Food particles enter into the trachea.
Okay, very good.
It's enter into the lung cavity.
So let me show you good. Okay, just imagine. No, just imagine this is your esophagus, and behind your esophagus you have a beautiful airway which is called as your trachea. Okay, so your trachea is this. Okay, and this is the lung cavity. So there is an epiglottitis.
Yes,
which cover this trachea when we are eating food. Right or no? When we're eating food, this trachea get closed. So food particle does not usually enter our airway. But just imagine one thing: if the patient is on any kind of sedative, okay, or the patient is in coma, okay, or there's decrease in the gag reflex, or there's a decrease in the cough reflex, and decrease in the swallow deflect, or for example, you're bringing back a patient from anesthesia. So the patient cannot swallow. These muscles are very relaxed. The muscle cannot swallow. So what will happen? So just imagine you have just given a food to the patient. Okay, listen one thing, very important thing. So who performed the swallow test after bringing back a patient from anesthesia?
ma'am.
Who performs swallow test when you bring back a patient from OT?
Yes.
Who performs swallow test after a patient is coming from anesthesia? Do you know what swallow test is? Anyone? Farhad, Subel, Junaid?
Test.
Rosaline?
Giving some little amount of water or anything. It's
okay.
No,
With
he
Dr.
said
RN
gag
can do.
reflex.
With Dr. RN can do.
With-
Yes. With Dr. RN can do. But who is the person who is authorized to do this thing? Listen one thing. There is a special person who is known as speech language pathologist. Speech language pathologist. They are the person who will perform swallow test before you introduce any kind of food to a patient who is coming from OT. And this is a very important line.
But in India, this work doing the nurses only.
In India, we are not giving an example of India. We don't care now. So I know what happening in sometimes, you know what, when I was working in a hospital, so uh, I was saying when a patient is having decrease in a gag reflex, okay, there's a difference in the gag reflex or cough reflex, or the patient cannot swallow, okay, or the patient is under anesthesia. So these muscles are very, very weak, okay. So what happened whenever whenever you're eating food particle, these food particle land into your airway, and they live in your, because you cannot absorb food from your windpipe, okay, there's no cilia present, you cannot absorption cilia, you cannot absorb food from your windpipe. Does anyone have a power to absorb food from windpipe among of you? Bilal Khan, can you digest food from your lungs?
No, 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 ma'am.
Pakka? Okay. So what happened? The food particle will land over here, and after some time, the bacteria colony will come and will grow, and they will grow like anything. And when the bacteria will grow, they will produce toxins from their body. Okay, the toxin will be covered, and they will infect your airway very, very badly. Okay, and this is called an aspirational pneumonia. Okay, the causative microorganism for aspirational pneumonia is your Klebsiella. Klebsiella, if you have ever heard of this Klebsiella
Klebsiella.
bad bacteria, Klebsiella, anaerobic bacteria, S. aureus, Cephalococcus aureus. So these are the causative agent which going to grow on your food and just do the happy party in your lungs, and you will get pneumonia. Understood? The first cause of
Yes.
pneumonia. Okay. Coming to the next cause of pneumonia, that is the inhalation in pneumonia. Okay. How come inhalation pneumonia? Okay. Just imagine you're living in a crowded, very, very crowded place like Mumbai or Beijing, some China. The people are living in a very, 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 very near about them. So whatever they are exhaling out in the airway, so it's all splattered in your airways. So what happened? So whenever there is an overpopulation, there is an increased risk of mycoplasm pneumonia. Have you heard of this mycoplasm? Okay, so this bacteria or chlamydia. Anyone know this chlamydia? What is chlamydia? Is a sexually transmitted diseases. Chlamydia is a bacteria which is, but it can also travel through inhalation. Okay. Okay. Next, influenza. Okay. Next, there's one thing I want to talk about, which is very, very important. That is histoplasmosis. Does anybody heard of this histoplasmosis? You must have heard this histoplasmosis.
मैम रिपीट करें.
Okay. I'm saying there's another type of pneumonia that is called due to inhalation of bacteria. Okay, so whenever a people who are living in very overcrowded places. So, for example, a patient is suffering from chlamydia or mycoplasm or influenza or histoplasmosis. So, what happened? The bacteria are saturated in the airway. So when we inhale this bacteria into our airway, and this bacteria goes into your lung, and you will get pneumonia.
Yes, ma'am.
Initially, the COVID-19 was also affecting your lungs. You know,
Yes.
initially they were showing the sign and symptom of pneumonia. You know, after the treatment of COVID-19, the patient was they were getting black fungal pneumonia. You remember in hospitals?
Yes. Yes.
Yes, ma'am.
Okay. There's one thing I want to talk about, that is your histoplasmosis. Does anybody ever heard of it?
No.
No,
Okay.
ma'am.
Histoplasmosis is a kind of fungus which is usually, yes, very good. Histoplasmosis is a kind of fungus which is usually grown with a bird poop. BIRD, bird. You know, bird potty. So whenever those people who are working with a bird or poetry farming means not a poetry means not a piece of paper or poem. Poetry means murgi palan, murgis. So people who are dealing with birds, especially chicken, hens, so their potty gets infected by histoplasmosis and is saturated in the airway. And these people get a fungal kind of pneumonia, which is caused due to histoplasmosis. Understood till now?
Yes, ma'am.
Yes.
Two type pneumonia. First is your aspirational pneumonia. You know why? Because there's no cough. Okay, so you cannot cough, or you cannot sneeze, or there's decrease in the gas reflex. You cannot swallow, so the food is entering in your food pipe. So whenever whenever food enters your food pipe, we like expulsive force of contraction we put, and we cough, and we try to expel the food out. Everybody must have. Okay, if I'm talking to you all and I'm eating food at the same time, so my body will get confused. Okay, so mistakenly if the food enters my food pipe, I will cough vigorously, and I will try to remove this food. But if I'm in coma,
On board.
if I'm in coma,
Bowler.
or
Tengola ka dates.
if I'm in coma, or the patient um if the patient is having stroke, okay, when their body is not working, there's paralysis of the lung laryngeal muscles, so we cannot cough, so the food will remain in the food pipe, and this will attract bacteria, and the bacteria will grow, and hence I will get pneumonia. Or even if I'm working in a poultry farm and I'm inhaling so much of histoplasmosis, and my lungs is getting filled with histoplasmosis fungus, and hence I'm getting pneumonia. So this is the second cause of pneumonia. Third is your something you don't have to remember the name, but understand what I'm trying to say. The patient is having microciliary clearance disturbance. It means that the airway is lined with your cilia.
Yes, ma'am.
Okay, so just imagine the cilia are not working. Okay, it can due to your COPD. You have damaged your cilia in your chronic bronchitis, or you have your bronchoatelectasis, okay, or due to the cystic fibrosis, bronchoatelectasis or cystic fibrosis, or any disease which in turn causes your damage to the cilia. So when there is no cilia, who is going to expel out any kind of food particle, any kind of bacteria away from your lungs? No one, and
Oh.
hence you will be prone for pneumonia. Okay. Hemophilian influenza, pseudomonas, so they will get a chance to increase, and they will cause infection in your body, hence pneumonia. Third is your IV drug users. So the people who are using drugs, drugs, what are drugs? Who's living in
Sedation.
मैम
no
जो people नशा करते हैं
Sedation.
a drug. IV drug users sedation नहीं होता है. कौन बताएगा मुझे IV drug users कौन होते हैं?
Narcotics.
अरे नाथी.
Cocaine.
Yes, now you're getting an animal.
Oh.
What does this O mean, Sashikala?
I thought drug means anesthesia. I
That
thought
also drug
that.
only. That also clinical means drug only.
That's not drug. No, that's not drug. We are talking about drugs.
Medications.
Govind Raj, are you getting my point?
Uh-huh.
The drugs where you're working, like narcotics, the people who are smuggling
Yes.
drugs and they're
Smuggling
injecting in
drugs,
their
yes.
bodies. Okay, so they are like they're sharing their needles. Okay, so I don't know. You have seen your documentaries or something like this. Does anybody have seen any kind of documentary or have seen people? I have seen so many people getting affected with IV drugs. So the whole world is getting polluted with such kind of mentality. And the people who are sharing drugs, so what they're doing? So, like for example, this is their vein, so they're putting this injection into their body. Okay. And due to this injection, there's a growth of bacteria because it is being shared by so many people. So this bacteria will grow and will infect your lungs. Lungs are the primary location of, they will come through your blood, they will grow into your pulmonary, and they will call pneumonia. Okay.
Yeah, I think
Especially
madam, I have one doubt. So usually when we are admin the injection, we clean with the alcohol swab. So who are using that drug, not cleaning that area. So directly inject, right? Due to that purpose only bacterial infection will grow.
Listen, I want to tell you one thing. Our body is your body act as a host for so many good bacteria and so many opportunistic bacteria. Your body, our face is having so much bacteria. Our body have bacteria there. Staphylococcus aureus is the normal bacteria which is present in the body, and our perineal area is also having good bacteria. Okay, our gut is also having bacteria, our face is having, but
Yeah.
when these bacteria from your body, through they are present in your skin, Staphylococcus aureus present in your skin. So when they will get opportunity to enter your body, when their immunity is low, or when you are providing with an opportunity to go and infect your body, when you're making yourself very immunocompromised, this bacteria will grow and they will grow into your body. Okay, so just imagine a patient who is an IV dragger, him or her, their immunity itself is very low.
Right. Okay.
Do you agree?
Yes.
Do you agree? Now they're sharing needles. They don't know how to do. Just they don't know that this. I want. Their single thing is that okay, I want this drug into my body. Simple. This. They don't care about needles. They use rusted needles.
Yes.
They use. Do you think they will use?
Yes.
First of all, I will use alcohol. Now I'll put it. They don't. They just want drugs. Simple is this.
Yeah.
So this is how they are. They already they are very immunocompromised, and you're providing them opportunity for the bacteria to go into your body and affect your lungs. Okay, so through blood, it can cause infection.
Yes.
Okay.
I got it.
Staphylococcus aureus is the main causative agent. Next is your people who are immunocompromised. Our airway, we just take everything from our body, from outside environment. Okay, so immunocompromised people. Can you tell me 5 people who are immunocompromised? Nayak Muhammad.
Autoimmune disease condition,
5 disease
cancer
condition.
patients,
Dialysis patient.
HIV.
cancer patients,
CKD.
Maybe, ma'am.
More.
They are also immunocompromised patient.
Yes,
patient
yes.
with
Dialysis
Immunocompromised
patient
people.
is also. Ma'am,
Pneumonia,
dialysis patient is also
ARDS,
compromised.
Sorry.
pulmonary effusion,
cancer patient, ma'am, autoimmune disease condition patient,
autoimmune disease patient.
ma'am,
What's going, ma'am?
HIV, dialysis, cancer.
So, which of the patient who is immunocompromised?
cancer patients,
Cancer patient.
More.
autoimmune condition patients,
Okay. Anything else?
HIV,
AIDS.
diabetes,
HIV. More. Diabetic mellitus. The
Diabetic
patient
mellitus.
who was on steroids.
TB
Okay.
patient.
Immunosuppressant. The patient who are on immunosuppressant. Okay. Next, sexually transmitted disease are patient who are more prone for infection. Okay. So these are the patients who are immunocompromised and they are very, very prone for any kind of infection. Let's start again. Can you all see the screen? Yes or no?
no, ma'am,
Can't see the screen. Now can you see the screen?
no, ma'am.
Okay. So now let's understand what do you mean by, can you see the screen now?
Yes, ma'am.
Yes.
Now tell me, what is the difference between hospital acquired pneumonia, ventilated associated pneumonia, or what is the difference between community acquired pneumonia? You must have heard 3 types of pneumonia. Can anyone just tell me what is all this thing? Does anyone know the difference?
Hospital acquired pneumonia means
Patient will stay prolonged. So cross infection will affect the pneumonia.
No. No. Read the line again. You will get your answer.
Get it from the hospital, ma'am.
Yes. The pneumonia that a patient is getting from hospital. Hospital acquired means pneumonia which is acquired by a hospital. How will you define that the patient is getting pneumonia from hospital or already the patient has pneumonia? So there's a rule. If the pneumonia is occurring after after 72 hours of admission, okay, so it means that earlier when you admitted the patient did not have pneumonia, and after 3 days the patient got pneumonia. It is known as hospital acquired pneumonia. Understood?
yes, ma'am.
Yes, ma'am.
Okay. So जब आपने पेशेंट को एडमिट किया 3 दिन के बाद पेशेंट को निमोनिया हो गया, इसका मतलब क्या है? हॉस्पिटल एक्वायर्ड निमोनिया. ओके, नाउ let's study about ventilated associated pneumonia. Ventilated associated pneumonia means when you kept the
Patient
patient
on
on
ventilator.
ventilator.
Patient on
When you
ventilator.
kept, yes, so 72 hours later, after keeping the patient on ventilator, a patient got
After
pneumonia. So the
72
timeline is 72 hours. So hospital acquired pneumonia, ventilated acquired pneumonia, and there's one more thing which is called as community acquired pneumonia. It means that when you kept a patient, when your patient was admitted in the hospital and in less than 72 hours, a patient got pneumonia. It means that the causative bacteria was from the outside. Okay, now the patient is showing the symptoms of pneumonia. Understood? The community
Yes,
has acquired
ma'am.
pneumonia, the time only 72 hours. Okay, if the less than 72 hours, it means it is due to community. If it is more than 72 hours, it means that either it is due to the ventilator or it is due to the
Or a
hospital acquired.
hospital.
Understood the difference?
Yes.
Yes, ma'am.
Okay. 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 Now let's understand what are the features of